Good morning, everyone. Welcome to East Liberty Family Healthcare Center. I am Rodney B. Jones, Sr., CEO of East Liberty Family Healthcare Center, also known as ELFHCCC, which is a federally qualified health center, also known as a community health center. I'm going to take a few minutes to help you understand the significance of a community health center as we celebrate 56 years of Medicaid. ELFHCCC is celebrating 39 years of providing quality, affordable health care for patients throughout the east end of Pittsburgh and across 5 counties. ELFHCCC is one of 50 federally qualified health centers across the state and one of 1,400 federally qualified health centers across the country. The 50 health centers in the state collaborate on multiple patient care and lobbying initiatives. And we work in partnership with our state association, which is called the Pennsylvania Association of Community Health Centers. The 1,400 community health centers across the country also collaborate on multiple patient and lobbying initiatives, and we work in partnership with our National Association of Community Health Centers. There are 9 community health centers in Pennsylvania, in Western Pennsylvania. In addition to ELFHCCC, they include Centerville Clinic, Cornerstone, Primary Care Health Services, Squirrel Hill Health Services, Community Health Clinic, Stowe Rocks Health Center, Northside Health Center, and Metro Family Practice. We are known as TRAC, which stands for the Three Rivers Alliance of Community Health Centers. Examples of the services that we provide include medical, dental, behavioral health, primary care, pharmacy, and a comprehensive outreach programs. We collectively occupy 48 offices throughout Western Pennsylvania, and we collectively treat over 100,000 people. Pennsylvania Health Center serves more than 917,000 through 300 offices throughout the state. We pride ourselves because we are the safety net for those who are uninsured, underinsured, and underserved. 20% of our patients have no insurance. 13% have Medicare. 25% have private insurance. But the significant thing is 33%, or 1/3 of the patients that we see, have Medicaid, which is why we are celebrating today as the 56th anniversary for Medicaid. Community health centers across the state pride ourselves on the fact that we treat everyone with dignity and with respect, whether they are comprehensively insured or have no insurance at all. Our quality metrics compared to other healthcare providers are second to none. It doesn't matter if it's a large hospital setting or a private doctor's office. Again, the quality that we provide are second to no one. During the past 1.5 years, our community health centers received national recognition for addressing the tens of thousands of COVID tests and vaccines in an equitable manner. And while we responded to the public health crisis, we stayed true to our mission by providing affordable, quality health care to everyone, regardless of their ability to pay. We couldn't have done that alone. I have partners from the health centers that are here. I have my team here, our medical founders, community people, our support. But we could not have done it without having a governor and a political engine that supports our initiative. This is why I am honored and proud to present to you Governor Tom Wolf.
So thank you very much, Rodney, for that nice introduction, and thank you for the nice weather too, by the way. This is really nice. It's nice to be back. I think I was here just before the pandemic hit, and a lot has happened since I was last here, so it's good to be back. And it's also good to be here to recognize and celebrate the 56th anniversary of the founding of Medicare. It's a makes this a especially fitting time to examine the successes we've had in providing crucial health coverage, but also to remind ourselves how important this is, how important it is that we keep working. We have challenges ahead. We've got to make sure that we do everything we can. Although we've driven the uninsured rate of Pennsylvania to the lowest in its history, we still have a lot of uninsured people, a lot of people who need access to health care. And I just want to reinforce the point that access to quality health care is really important. It's the right thing to do, and I've been fighting to expand access to health care since I took office. And that's why one of the first things I did was to expand Medicaid, which drove our uninsured rate to the lowest in history. And I've also continued to advocate strongly against those who would want to roll back things like the Affordable Care Act, which actually provides health care coverage for 1 million Pennsylvanians. So we have done a lot to implement collaborative, innovative programs to improve health care outcomes for Pennsylvania, and we want to continue to do that. Last year, Commissioner Altman worked really hard to start trying to figure out how we here in Pennsylvania, working on our own, can reduce health care costs and improve accessibility, improve equity, improve the value of health care for everybody in Pennsylvania. All these goals are supported by the launch of Pennie, which again, Commissioner Altman really was responsible for driving. Zach done a really remarkable job administering. 2 years ago this July, I signed the Pennie legislation that ensured Pennsylvanians have access to affordable health care coverage through this one-stop shop for Pennsylvanians. And I think last year when we went out, we advertised that actually with Pennie, we were promising lower health insurance premiums. Now think about that. That's not lower rates of growth, of increase in health insurance. It was actually a decrease in health insurance premium costs, which is really a remarkable thing given what we've all gone through. The idea is that Pennsylvanians who need or want health insurance coverage through the marketplace can access all the information they need, and if they need it, get insurance through Pennie. Pennie provides world-class customer service to help all Pennsylvanians understand what their health care options are, as well as providing information about financial assistance for those who need it. This means a number of things. It means that more Pennsylvanians will be able to get affordable health care coverage. It means that more Pennsylvanians will be able to see a primary care doctor. Now think about that. The emergency room is not going to be the first source. It's going to be the last place they go. They're going to have access to primary care doctors. More Pennsylvanians will be able to manage chronic conditions. And crucially, more Pennsylvanians will live healthier and longer lives. That's what this is about. And I'm going to continue to work to expand health care coverage because it's the right thing to do. But I also want to point out, having been a business owner, I mean, I've been in politics now for just under 7 years. Before that, I was in business. And I recognized then, as I do now, that health care coverage is the right thing to do, morally. You know what? It's also practically, economically, the smart thing to do. And so access to health care is a public good, and we've got to recognize that. We all of us benefit from a society that ensures health care access to all, not just through improved health outcomes for our families, for me, and for people we know, but accessible health care coverage is good for businesses. If everybody has it, all businesses benefit, all entrepreneurs benefit, all employees benefit. This all supports economic growth and opportunity for us right here in Pennsylvania. When health coverage is readily accessible, all businesses see lower rates of insurance premium. We also see lower rates of absenteeism, lower rates of turnover. Employees can invest their talents and explore opportunities without fear of losing necessary health coverage. We don't have job lock that affects millions of people across the country. And we all benefit from the economic boost that comes when entrepreneurs have the freedom to support new businesses. That means creating new jobs, new products, new services that we can't have if we don't have universal access to health care. Our current system is so full of hidden costs and unfair cross-subsidies that it's needlessly expensive. When we would pay each year in my company for our health insurance premiums, we would sort of try to figure out how much of what we were paying for health insurance was actually going to subsidize those employers who were not giving their employees adequate health care coverage. And it was usually a pretty big percentage. We knew that, but we had to do it because if we didn't, we wouldn't be able to afford to have health insurance. The health insurers, the hospitals would not be able to stay in business. Because our nation fails to treat essential health care as the public good that it is, the costs for this are dumped on the back of employers, like I used to be. When free-riding employers fail to provide adequate coverage or any coverage at all, that increases the cost of health insurance for responsible employers. People who don't have access to preventative health care often can't afford to seek care for their emergency or even chronic conditions unless they go to the emergency room. And when they get there, it's usually too late and it's too expensive. So expanding health care coverage lets people get treatment they need when they need it, which results in better and less expensive outcomes for all of us. Our lives, our businesses, our communities, our economy, they're all made better by broader access to health care. We got to make that a priority. Expanding Medicaid coverage and lowering costs through Pennie are important first steps toward improving our health care system. My administration will continue to fight for affordable, accessible, quality health care for all Pennsylvanians. There's more we can do, especially at the federal level. I know I've been talking about Medicaid. Medicare also is important, and we need our federal leaders to push to make both Medicaid and Medicare better. Right now, there's some programs to make Medicare cover dental, vision, and hearing services, and I applaud the federal leaders who are pushing that. We need to do that and more. This is another crucial way that we can build success at the local level and ensure that the next generation of Americans has access to the health care coverage they need and deserve. So thank you, and now I'm proud to turn this over to Zach Sherman, who's the Executive Director of Pennie. Zach has done a phenomenal job. Thank you for being here. Zach Sherman.
Thank you. Good morning. Thank you, Rodney, for hosting us today, and thank you, Governor, for bringing us together to talk about connecting people to quality, affordable coverage. I'm Zach Sherman, and I'm the Executive Director of Pennie. Pennie was created 2 years ago by Pennsylvanians to meet the needs of Pennsylvanians. As a result, and through the implementation and the American Rescue Plan, health coverage through Pennie has never been more accessible or affordable than it is today. If you are currently uninsured without health insurance, you can enroll right now, right today at pennie.com. And if you do so by midnight tomorrow night, your coverage will begin on August 1st. Simply put, we help Pennsylvanians get the coverage they need and connect them to the financial assistance necessary to make it affordable. Pennie is the only source for financial assistance for Pennsylvanians accessing coverage through the individual market, which is often the deciding factor between families having coverage and going without. In response to the public health and economic impacts of the pandemic, we have opened up an enrollment period that is open right now and is known as the COVID-19 enrollment period. Anyone uninsured or interested in affordable alternatives to their existing coverage should check us out. Pennsylvanians have until August 15th to apply, and since we opened up this enrollment period on February 15th, over 55,000 Pennsylvanians have signed up new for coverage. We broadly strive to increase the number of Pennsylvanians with coverage regardless of their income or eligibility status. And because we're now a new state-based entity, we can work with our partners in government to make it easier for Pennsylvanians to get covered. We operate a no wrong door policy to ensure that those eligible for programs through the Department of Human Services like medical assistance and the CHIP program, that they have an ability to get connected to coverage even if they come to us. When we say no wrong door, what we mean is no matter your circumstance, if you come to us, we'll make sure you get to the right place for the right coverage. We also work closely with the Department of Labor and Industry to deliver a key American Rescue Plan benefit, which provides the maximum amount of financial assistance to our customers for anyone who is also receiving unemployment insurance in 2021. Through this partnership, we were able to automatically deliver this benefit to existing customers, connecting tens of thousands of Pennsylvanians to plans with low or no monthly payment. These partnerships and the American Rescue Plan have created a safe haven for Pennsylvanians in need of affordable coverage during the pandemic. Through Pennie 90% of the nearly 340,000 Pennsylvanians signed up today are receiving financial assistance. The average premium after financial assistance is almost half of what it was earlier this year, down to $86 a month. Over 50% of our customers have no monthly payment, with the financial assistance covering the full cost of their premium. And more people are signed up. As I mentioned earlier, over 55,000 customers have enrolled new since February 15th, and enrollment is 10% higher today than it was a year ago. We strongly encourage anyone seeking health coverage to visit Pennie.com and enroll today to receive these savings. To get covered, all you need to do is apply and enroll using our COVID-19 enrollment period that is open to all Pennsylvanians and runs until August 15th. That's Pennie.com, Pennie.com, or give us a call at 1-844-844-8040. If you enroll by tomorrow night, your coverage will begin on August 1st. So thanks for the opportunity to be here and for all of the presenters talking about this important issue. I'm now going to turn it over to a Pennie customer, Joy Militello, who can tell this important story so much better than I. Joy?
Hello, my name is Joy Militello, and I am a participant in Pennie. I haven't written down anything to talk about today because I am going to speak from my heart. And I'm pretty sure I speak for many people's hearts in Pennsylvania. I'll tell you a little bit about my personal story. I moved here from Raleigh, North Carolina at the end of 2020. And a month later, I found myself unemployed due to COVID and without health care insurance that my employer had provided me previously. I really was lost for what to do. I was in a new place. I didn't know where to turn. And somebody suggested that I call Pennie. And I have to say that Pennie rescued me. They gave me a lifeboat, and they helped me navigate the healthcare providers in Pittsburgh, which I had no idea about because I was brand new here. And they guided me toward the policy that would suit me and my budget. So I was able to afford quality health care through Pennie that I otherwise would never have been able to afford. I had an emergency in May. I had to have an emergency appendectomy. And thank goodness I had a health care policy that covered me. Otherwise, I'd be bankrupt with $24,000 owed to the hospital. So I hope Pennie continues. I hope it grows stronger. And like Mr. Rogers says, look for the helpers. Pennie is a helper.
Thank you, Governor Wolf, for this opportunity. My name is Lily Gorey. It has been my pleasure to serve as a health insurance navigator and enrollment assister since 2018. Through a collaboration with the Consumer Health Coalition and the Pennsylvania Association of Community Health Centers to offer no-cost, unbiased, in-person enrollment assistance. As an enrollment assistant, I have seen many changes with the health insurance marketplace landscape. Providing in-person enrollment assistance is key in helping consumers navigate the complexity of health insurance and its options. The expansion of Medicaid in 2015 was the first big step at offering more coverage options to vulnerable populations statewide. Then when we moved to our own state-based marketplace using Pennie, consumers were unsure of what options would be available or if the insurance would be affordable. Through outreach and education, I have provided direct enrollment assistance to hundreds of families, single moms, immigrants, those who have lost coverage due to COVID-19, those who speak Spanish, people moving from other states into Pennsylvania, workers who didn't have access to coverage, through their employers or people who just thought it was too expensive, until now. During this year working with Joy and so many others, I have seen affordable coverage options available to those who were not able to access insurance they could afford or even afford to use. With changes due to the American Rescue Plan, the amount of financial assistance available to Pennsylvanians has increased. And so many have benefited from the security of knowing that if something happens, like she said, they will not go bankrupt, they will be covered. Historically, people earning more than 400% of the federal poverty level were shut out of assistance. But now, no one will pay more than 8.5% of their income in premiums. Individuals who lost their job or experienced a reduction of their hours are able to enroll due to a covered special enrollment period through their prior employer at no cost until the end of September. These and other options are available for consumers who might have gotten married, divorced, moved, or had other life change events. For those who are uninsured, there is still time to enroll in coverage through a COVID-19 special enrollment period until August the 15th. For those who have obtained health insurance, that is not the end. Moving from getting coverage to utilizing the coverage through primary care completes that cycle. Accessing primary care at a community health center provides you with more care, quality care, dental, behavioral health, pharmacy, and much more. The health insurance coverage through Pennie includes preventive care at no cost. For consumers, understanding premiums, deductibles, summaries of benefits, and provider networks can be a complex, but enrollment assisters are knowledgeable and can walk consumers like Joy through that process. I have a couple consumers, one from Allegheny County, that said, and I quote, "Working for a small nonprofit organization, I'm unable to afford the monthly rates for the health care that I'm able to offer. I thought I was going to have to choose between health care and a place to live, in which case I will have to choose a place to live. The stress I will feel in that situation will be detrimental to my health. Because of Pennie, I'm able to have both, and I'm so grateful." Another said, "I was separated from my employer in mid-May 2021, and a family member alerted me to go to Pennie. I was very relieved to learn how it worked and that I would be eligible for a reduced out-of-pocket expense for health and dental insurance." Once I got in touch with Pennie, well, he talked about me. Lily was very professional and walked me through the process, and in no time I was insured. So hearing Joy's testimony and the testimony of hardworking Pennsylvanians make me grateful for this opportunity to be a health insurance assistant and a community health educator and to help people change their life. I want to thank everyone that made an effort to make sure that the Marketplace Pennie is more affordable and more accessible. We will continue to make sure that every Pennsylvania is covered and everyone that lives in Pennsylvania is protected. Thank you, Joy, for the privilege, and thank you, Governor Wolf. Yes, I sit there. Let's switch seats then.
Good morning, and thank you, Governor Wolf, for asking me to join you all today. My name is Meg Sneed, and I'm the Acting Secretary of the Pennsylvania Department of Human Services. All Pennsylvanians should have access to affordable, quality health coverage. Today, we mark the 56th anniversary of President Lyndon B. Johnson signing the Medicaid program into law, a program that today provides health coverage to more than 3.3 million Pennsylvanians. A program that ensures that those Pennsylvanians have the health care and support they need to live, grow, and thrive. These 3.3 million Pennsylvanians include children, people with disabilities, older Pennsylvanians, and many others. In 2015, Governor Wolf accepted the Medicaid expansion permitted by the Affordable Care Act, which today allows nearly 1 million Pennsylvanians access to health care. Medicaid expansion is a lifeline when people need it most. Medicaid expansion provides relief and continuity when the unexpected happens. Everyone deserves the security of knowing that you can go to your doctor for normal visits and screenings, that a prescription will not further risk your financial stability, that if you get sick, you're covered, For nearly 18 months, each of us have been living through that uncertain future that we cannot always prepare for. What we are experiencing today, a prolonged global pandemic and economic crisis with historic unemployment, is not something that we knew would happen when Governor Wolf expanded Medicaid in 2015. But because of that expansion, more than 970,000 people in Pennsylvania have health care who would have gone uninsured otherwise. Their individual circumstances and stories are different, but many of them could be in this position because of a lost job or lost income due to COVID-19. They didn't plan for this. They didn't ask for this, but this is the reality we have been living through. Imagine being in that position, losing your job due to the economic realities of a public health crisis, and then losing your health care in the middle of that crisis. As we all continue to navigate this pandemic and our economic recovery, healthcare coverage will help create a stable ground necessary to rebuild and move forward. If you aren't healthy and taking care of your basic needs, you can't think about getting a job. And before the pandemic, we found that more than half of our Medicaid expansion population is working a job that does not offer healthcare coverage. And when people leave Medicaid coverage, many are doing so because their income is increasing. As so much is uncertain, this security can make all the difference for people, and it's something we need to emerge stronger through these difficult times. Medicaid expansion can help make that possible. Thank you again, Governor Wolf, for asking me to join you today and for your tireless commitment to the health and well-being of Pennsylvanians. It is now my pleasure to introduce Lauren Stuperitz.
Hello. My name is Lauren Stuperitz. I'm 36 years old. I've been on Medicaid since 2014, and right now I'm a mom to a 1.5-year-old working part-time. Before I say more about my experience with medical assistance, I would also just like to say that something Governor Wolf was talking about with small businesses and for people who are self-employed. I come from a family where my dad has been a small business owner. He has a small family business since the 1970s, and so even as I was growing up, there were 4 of us kids, and we were able to use the children's health insurance program, so it's something that's important to me in that respect. Right now I'm working part-time in a medical education program at the University of Pittsburgh Medical School. And I became eligible for Medicaid expansion when I was trying to recover from a traumatic head injury after a violent attack. At the time, I was on a long waiting list for a waiver program that would have covered me, but only for a limited number of months, and I was really desperate. I had no access to health insurance through any other way or work at the time. But thankfully I was able to enroll in Medicaid, and with my Medicaid coverage, I was able to receive mental health care for my PTSD and enroll in an outpatient program that was life-saving for me and that helped rehabilitate me from the head injury. Without Medicaid, none of this would have been possible or remotely accessible. I would have either been left with extremely expensive medical bills from all the treatment that I needed, or I would not have been able to access care and receive any care at all. I'd be overwhelmingly in debt and much less able than I am now to maintain any professional work if I hadn't gotten the comprehensive physiological and mental health treatment that I did with my Medicaid coverage. And overall, my quality of life would be a lot worse if I hadn't been able to access the health care I did. So medical assistance has been really integral in my life, not just in the last 8 years. So over the last 8 years, I've been able to get office visits with specialists, diagnostic tests, medications, counseling, and physical therapy, all for free with Medicaid at the most difficult time in my life. When I was really struggling and suffering financially, physically, and personally. For example, I was able to do an outpatient pain management program, and I was able to get access to a specialist in physical medicine and rehabilitation who had experience working with patients who had traumatic head injuries like me and survivors like me. And this specialist was instrumental in helping me move through the recovery process from my injury and trauma. Eventually, I was able to get Medicare for my disability, and since then have been on different Medicaid programs, such as Medicaid for workers with disabilities, traditional Medicaid, and Medicaid during pregnancy and for postpartum care. I've even been able to maintain my health coverage throughout the pandemic, which has been such a source of relief to me as a new mom. Without this coverage from medical assistance, I wouldn't have been able to afford all my medical bills, or let alone even just the co-pays, because I only work part-time. Right now, Medicaid is still supporting me to maintain my health for myself and my baby, and it's made it possible for me to somewhat recover from my injuries and stabilize my health over the last several years to the point where I can now have meaningful work, focus on my family, and trust that I have the healthcare access I need to keep myself strong for them and to keep pursuing what's important in my life. I'm very grateful to have my Medicaid coverage that's been possible through Medicaid expansion that we have in Pennsylvania, and I sincerely hope that everyone is able to access the healthcare that they need. And now Jessica Altman.
Good morning, everyone. My name is Jessica Altman, and I serve as Pennsylvania's Insurance Commissioner. It's such a privilege to close out today hearing so many important things and stories. And so I'd really like to begin by thanking Governor Wolf, my colleagues, the elected officials who have been with us along the way, for their dedication to ensuring all Pennsylvanians have access to affordable, quality healthcare coverage. I'd also like to thank Rodney and the East Liberty Family Healthcare Center for hosting us and for their commitment to the community. I'd also especially like to thank Lily and the sisters and public health workers like her who do this work every day, and to people like Joy and Lauren for being willing to share their stories with us at events like this. Our message today is clear. Health coverage has never been more within reach in Pennsylvania. Governor Wolf and those of us privileged to serve in his administration have prioritized making healthcare coverage affordable and easy to obtain. Through the Medicaid expansion, our new health insurance marketplace, Pennie, and programs like the Pennsylvania Reinsurance Program, Pennsylvanians have more options for coverage for themselves and their families than ever before. As Acting Secretary Snead talked about, Medicaid expansion has been the most critical safety net for coverage that we can really imagine, thanks to Governor Wolf's critical decision to expand. And in addition, the American Rescue Plan, also known as the COVID-19 Relief Package, includes a myriad of changes that have already helped many Pennsylvanians with private health insurance coverage as we continue to grapple with the challenges of COVID-19. For health insurance, the American Rescue Plan resulted in significant impacts, including huge, life-altering savings for those that want to buy health insurance for themselves and their families, those already enrolled through Pennie, as well as those who may lose their job and rely on COBRA to maintain their employer coverage or transition to Pennie. With these historic savings, we hope this will serve as an opportunity to reduce the number of uninsured individuals and provide the peace of mind that comes with having health insurance to more Pennsylvanians than ever before. And that peace of mind has never been more important. Comprehensive, affordable healthcare coverage for all is a fundamental need in any time, but especially so as we have and continue to deal with COVID-19. Fear of an unforeseen bill should never be the reason that any Pennsylvanian forgoes COVID-19 testing, care, or vaccination. While the pandemic has uprooted coverage for many families and individuals who lost their jobs during the economic unrest, the Commonwealth's healthcare programs have provided a safety net to so many during this time, ensuring coverage for all COVID-related services. So August 15th marks the final day for anyone to apply for health coverage during the COVID-19 enrollment period through Pennie and to receive these additional savings in 2021. The next available time to enroll, absent a special like circumstance in health coverage, will be Pennie's open enrollment period, which begins on November 1st for 2022 coverage. But it's also important to note that medical assistants and CHIP enroll new people all year round. So I urge Pennsylvanians to think about their health care and insurance needs and consider shopping around on Pennie with that no wrong door policy to ensure that they have coverage that meets their needs and their situation. Finally, I want to stress that the insurance department is always here to help. If any consumer has questions or concerns about their insurance, and not just health insurance, any insurance, I encourage them to contact us. Our website is insurance.pa.gov, and our consumer hotline is always available at 877-881-6388. Thank you, and it is now my privilege to turn it back to Governor Wolf, who would be happy to take questions.
So thank you, Secretary Sneed, Lily, Lauren. Lauren, where are you going? You're leaving? Okay. All right. Commissioner Altman, Rodney, Zach, and Lily. Joy. Sorry. Okay. Now, we'll be happy to take questions.
Does this mean the healthcare centers like East Liberty Family Healthcare that is federally funded?
Well, it's both federally and state funded. The state contributes to that, and by doing what we've done through the expansion of Medicaid and Pennie, it actually makes places like this available to more people, and that's really what we need to do. As I say, the Affordable Care Act was a really important first step. I think Commissioner Altman has done some remarkable things here in Pennsylvania to provide more access. But in the end, it comes down to one thing. Places like this, small health centers everywhere, need to get paid. And if we don't have some form of assistance, the chances that they're going to get paid are less. And if that happens, they're going to have a harder time staying in business. So it means a lot. And Rodney, am I right? I mean, if we didn't back this and hopefully continue to do more, places like this would have a really hard time surviving. Anything else?
Governor, in regards to the text you're trying to send to people who haven't missed their second vaccine shots, you have Republican colleagues saying that's an invasion of privacy. What would you tell your colleagues from back there in Harrisburg?
It's not an invasion of privacy. It's saying, this is our strategy, and Pennsylvania actually has done a remarkably good job. I think we're #1 in the nation when it comes to the 65 and older population who's gotten vaccines. That's Republicans, Democrats, rural, urban folks who have gotten that, and it really has worked. Pennsylvania is one of the best states in the nation in terms of the case count. Every state is going through an upsurge, and we're no exception to that. But I think we're at 5 cases per 100,000. The national average is over 20. So I mean, we're one of the best in the country. I think 6th as of this morning, at least by figures that I saw. And the reason we are there is because Pennsylvanians have done a good job making the individual decision to get a vaccine.
Any thought of requiring state employees to be required to have the vaccine?
I mean, we're trying to do everything we can to keep folks safe who work in the administration. I think you're talking about the executive branch employees. Yeah, I don't have any control over any of the others, and I don't have any plan to try to do a statewide mandate. But yeah, I think we're trying to do everything we can to encourage. I just wrote a letter to public officials to say, use your bully pulpits. Local officials, members of the General Assembly, senators, representatives, do what you can to convince people and your constituents to get the vaccine. That's the strategy. That's what's going to beat COVID.
I know this is a little bit off topic, but do you have any message to Pennsylvanians with the eviction moratorium ending tomorrow?
Yeah, the question was, do you have any message to Pennsylvanians because the eviction moratorium ends tomorrow? And yeah, that is something that is a looming issue all across the country. We knew it was going to come sooner or later. and it's coming tomorrow, and that's going to create all kinds. There are real questions. How are people going to afford them? It's one thing to say that the national savings rate is well above $2 trillion, but what does that mean if you're actually a tenant and you're facing eviction, or you're facing that, or paying months and months of back rent? At this point, it's unknown what that consequence specifically is going to be from a macro point of view, but there are going to be a lot of individuals who are going to be affected very negatively as a result of that. Oh, yes, sorry. The Secretary of Human Services would like to say it. Did I say anything wrong? Or
No,
just
not
enough?
at all. No, just bolstering your comments to say that the Department of Human Services is administering the Emergency Rental Assistance Program on behalf of 47 counties. 18 counties in the city of Pittsburgh got their own direct allocation. But at the end of the day, we're likely to have north of $1 billion available in Pennsylvania for emergency rental and utility assistance. Those programs have been up and running since March. We would encourage people to apply today. The eviction moratorium obviously lifts tomorrow, but those funds will be available for the foreseeable future. There is enough money in the emergency rental and utility assistance space to assure that nobody is evicted if they meet the income thresholds as a result of COVID. So please apply today. You can go to our website at www.dhs.pa.gov/ERAP or ERAP, and you can find all 67 counties are administering that program now. So please don't wait and apply today.
Thank you. Thank you. So we are concerned and we are doing something about it. Any other questions? Yes. Hi.
First of all, I want to say thank you for being down here. And I want to ask a question. Now, it's being on Medicaid, as far as...
Wait a minute. Now, you might be asking a technical question, so I'm glad I have some people who can answer it. That's fine. So go ahead.
Okay. As far as income is going up, okay, like food is going higher.
Right.
We're going to be getting a little increase in a little bit for our Social Security. Okay, now, Medicare, you get so much money. Once you're above that level, then you're off.
The cliff.
Yes. Okay, so what happens when I get to that level from a little bit of money? I'm going to get this coming this year.
Yeah.
And from the food going up higher, everything's going up higher, and I get to that cliff, and now my Medicare is gone. What happens to me?
Yeah. Let me just explain. Then I'm going to turn this over to somebody who can answer that specifically. But in general, what you're talking about is a really big problem. We have public assistance programs and everything from food to health to it's not just Medicaid. But if you look at what happens as people go up and actually do what we want them to do, and that is earn more money and build a career, they actually don't just sort of gradually phase out of public assistance. They come to a cliff. And for a time, and this is debilitating for many, that they come to a point where they're actually making a lot less net, given the extra expenses they have. They're taking home a lot less because of that cliff, and that's a real problem. So Jessica, or Commissioner Altman will answer the specifics of that question. It's a good question.
It's actually a perfect question for today because it highlights both the Medicaid program and the role of Pennie in providing coverage to Pennsylvanians. So first of all, I want to mention that actually during the federal emergency period for COVID-19, the Medicaid program is not disenrolling anyone, even if their income changes. Now, that's not a permanent thing, but it is here right now, and so there shouldn't be any immediate fear of an income change causing a change in your coverage. But normally, in a normal year, the way that it's set up is if your income goes above the Medicaid eligibility threshold, that's the technical term we use, that's where you have Pennie. And Pennie offers subsidies, as we've talked about, financial assistance based on your income. And if you get just over that Medicaid threshold, you're going to get a very significant financial subsidy. And generally speaking, what we're seeing right now, particularly with the American Rescue Plan, is $0 premiums monthly and often $0 deductibles at that level. So you're still talking very affordable coverage. And I would really recommend, if you come in that circumstance, that you call Lily or someone like Lily, free, unbiased assistance who can help you navigate that. And if you do need to make that transition, make it as smooth for you as possible. Also, medical assistants and Pennie, they talk to each other, so your information can get automatically transitioned over, trying to make that as seamless for you as possible if that is your circumstance in the future. Sure.
Meg, do you want to add anything? No. Okay. Any other questions? All right. Thank you very much, everybody. And again, thank you, everybody. Meg, Lily, Jessica, Rodney, Zach, and Joy. And Lauren. It's down there. Lauren. Okay. All right. Thanks, everybody.